Welcome to our channel Ayurveda. Today we are under the crisis of a coronavirus or COVID-19. Once upon a time, there was a spread of a dengue, malaria, chikungunya, plague, etc. On that time, people used to say there is no medicine in Ayurveda, but now also they used to say the same thing. But we know in our science we have everything. So today I am going to talk about a little about the concept of a communicable and epidemic disorder in Ayurveda in general. We can come across a reference in Charaka Vimanasthana, third chapter, about Janapada Udvamsa. Janapada Udvamsa means the complete destruction of a community. So there, Atreya is telling how it is going to happen because of the vitiation of Vayu, Jala, Desha and Kala. How these four are going to vitiate? Because of doing adharma or doing papakarmas, that is violence, etc. All things will come under the same. Doing adharma or a papakarma, or because of abhishaba, also cursing from elders, or curse of a god, or a curse of a gurus, this all can cause. So Charaka is telling there, like, even though the prakriti of the individual are a different, the vaya of the individual are a different, satmya is a different, sattva is a different, everything are a different from person to person. But there, if their vitiation of vayu, jala and desha and kala is there, vitiation of these factors will manifest or will cause the complete destruction of the community. There Charaka is telling there, we can say that as a whole we can conclude that if the vitiation of these four factors, that is vayu, jala, desha and kala, so we can understand from his explanation that there is an rearrangement of rupa, rasa, gandha and sparsha of that four factors. So next, second reference we can find out in Sushruta Samhita Nidhanasthana, fifth chapter. There he is telling clearly that how the disease can be spread from one person to another person. Okay, from one person to another person. There he is telling that prasangat gatra samsparsha, that is direct contact or touching with a patient, direct contact with the patient, or inhaling the shwasa of the patient, or eating with the rogi, or sleeping with the rogi, sitting with the rogi, or sharing the vastra or his garland, etc., can cause or can lead disease can be spread from one person to another person. So if disease is spreading like this, we can name under Sankramana Rogas. So how the Sankramana Roga is going to manifest, that is because of a direct contact with Rogi, inhaling the air of or shwasa of the Rogi, direct touching or eating with him or sleeping with him, or sharing the vastra or a garland of a patient. Okay, so this all can lead to disease can be spread from one person to another person. So this can be come under, or this can be named under one heading, that is Sankramana Roga. Okay, now they are calling it as a coronavirus. So next, how we can approach such diseases? So we don't have any name. So there Charaka is telling the one who cannot label a disorder with some name should not feel ashamed, because all disorder have no established footing by name. The reason is that the same vitiated doshas cause the various disorders according to various nidhanas and samrapti, sthana samshraya, etc. Hence, one should not initiate a treatment after having the complete knowledge about the nature of the disorders. Okay. So there also he is telling again, Charaka is telling the treatment protocols. We will see how general treatment protocol in Krimi Roga, that is, one is Abakarshana, Prakriti Vikhada and Nidhana Parivarjana. Okay, Abakarshana means the extraction of a parasite, or we can say extraction of a foreign body. The next one is Prakriti Vighada, that is destroying the environment for the growth of parasite. Completely destroying the growth, completely destroying the environment for the growth of the parasite. We should not allow them to grow in our body. So we should be remove that. Next one is Nidana Parivarchanam, that is should be away from the Nidhanas, that irrespective of doshas like Vada, Pitta and Kapha. Next treatment protocol is Charaka is telling in Vimanasthana Karmam Panchavidam Tesham Beshajab Paramuchade Rasayanam Vidhi Vachobayoga Prashasyadi. So he is telling Panchakarmas, Shodhanas are needed for such patient. Then Rasayana Karma also is needed. Then a drug should be used, that is before previously collected, that is before the Janapado Domsa, that drug should be used. Drug should be used before Janapado. Drugs collected previously Janapado Domsa. Then Deva Vyabhashraya Chikilsa also important. So these are some of the treatment mentioned in treatment protocol are mentioned by Charaga. Panchakarma, Rasayana and Deva Vyabhashraya Chikilsa. About Rasayana we will discuss in coming videos. So Panchakarma or Panchashodhanas, Vamana, Virejana, Diruha Basti, Anavasana Basti and Nasya are very important. Which dosha is vitiated, based on that we have to plan the Panchakarmas. Then Rasayana is needed for boosting the immunity. Charaka is telling we should give in Janapado Domsa only, we should give him or we should administrate the medicine. It should be increase the immunity of the patient. So through Rasayana we can improve the immunity of the patient. Then Deva Vyabhashraya Chikilsa also very important. Then some of the preventive medicines can be used like Vilvadi Guliga, Shadangapana, that is mentioned in Shadangapana is mentioned in Jwara Dhyaya. Then in Vilvadi Guliga there is an indication for Bhuda Vida. There is an for evil spirit also. One of the indication that we can give. So here we can consider it as because of some krimi or something. Then Sudarshana Guliga, Indukanda Kashaya, Abaraj the Duma, or Chanprash. This all are some of the we can use as some of the preventive medicine. But even though this all the medicines can be vary from person to person, because the Prakriti via Satmya, Sattva, everything of an individual is different. So using of this all the medicine can be vary from one person to another person.